The fact that medical debt is the most common in collections implies that people with the debt are most contacted compared to anyone else. Medical billing and collection practices often prove to be very complex for patients who are required to navigate entire processes of seeking healthcare on their own. Obviously, prices are higher for the uninsured and out-of-network patients, with the prices also varying with facilities and the respective agencies. Third-party collection agencies have limited access to provider and insurer records, thereby making interaction with the patient even difficult. Providers' billing practices have a significant impact on the amount of medical debt patients may be required to take on, which could in turn affect patients' financial health. Some providers and healthcare institutions have guidelines and policies in place to ensure that services are priced fairly. Patients who are eligible for financial assistance actually know about it and have access to it, and their clients are not subjected to aggressive collection actions. But it's just some. After a patient receives care, the provider bills the patient and the insurer if they have one. The bill is highly influenced by the provider of choice, the services offered, and the kind of insurance that the patient has. Uninsured and out-of-network patients often have the highest medical bills, often translating to higher medical debt. Interestingly, some studies suggest that most people with medical debt are insured even though the uninsured are more likely to be charged higher prices for the same services, with some studies pointing out that the uninsured are charged on average 2.5 times more than the insured for healthcare services or 3 times the amount allowed by Medicare. The amount of money charged to the uninsured implies that even though more insured people have medical debt, the larger individual medical debts are borne by the uninsured, which is largely associated with the fact that the uninsured have lower incomes. The whole paradox of insured people being more likely to be in medical debt is largely explained by the fact that uninsured people, more often than the insured, mostly postpone accessing healthcare until they actually need it. Insurance for the insured often serves as a safety net of some sorts that makes them more likely to proactively as opposed to reactively seek care, thereby making them more vulnerable to faulty bills and out-of-pocket expenses. The prices charged to patients vary for similar services and even more, beyond the cost of providing care. Most American patients do not understand their medical charges, with only a third being aware that healthcare providers should disclose their prices. This lack of price transparency has been responsible for some worrying statistics such as the fact that 57 of the top 100 hospitals in America charge patients more than 5 times what they're actually required to pay for the services they received, or the fact that 50 American hospitals that register the highest charge-to-cost ratios charge patients about 10 times the amount allowed by Medicare. The most twisted part is that hospitals that attend more to minority communities, especially blacks and Hispanics, register some of the highest markups. You might think the high charge-to-cost ratios translate at least to better care for patients, which could then make it a bit understandable, but no. Some studies have reported a positive relationship between increased price-to-cost markup ratios and a higher risk of post-operative complications and death. The explanation for the relationship, you might wonder? All to do with when hospitals stopped being run by medical professionals to being run by business people, evidenced by the fact that investor-owned hospitals report the greatest markups. Emergency situations are when most patients, especially the uninsured, actually seek care, are the most vulnerable, and have the least amount of time to shop around for prices. The lack of time to window shop for hospitals is evidenced by the fact that median markups are twice as high in emergency room visits compared to hospital internal medicine departments. During an emergency, patients don't have the luxury of shopping around, but they actually do when seeking prescription drugs. So, hit the patient when they're at their most vulnerable point, quite classy. Even though half of all patients try as much as possible to know treatment costs before actual treatment, very few hospitals provide patients with all the necessary information to make the right price-related decisions, at least in ample time. Limited price transparency provides room for surprise billing, which occurs when a patient seeks care at an in-network facility, but they end up receiving care from an out-of-network or provider. Receiving care from an out-of-network provider results in charges higher than what would come from an in-network facility. Surprise billing is worsened by high-interest rate medical credit cards whose interest ranges from 13 to 29%. The credit cards prevent patients with unpaid bills from accessing charity care or any related financial assistance programs. The credit cards are predatory to a certain degree since they are easily accessible in physicians' offices and approval only takes seconds. Considering the circumstances surrounding people interacting with healthcare systems, patients feel pressured into taking the medical credit cards, while others feel like they were provided with intentionally misleading information. The No Surprises Act seeks to provide additional protections to patients receiving out-of-network treatment in a number of ways. First, the Act requires patients to pay the in-network cost-sharing amounts of emergency services for when they unknowingly receive non-emergency care from an out-of-network provider in an in-network facility. Second, the Act also forbids hospitals from charging patients directly by recommending charges go through third-party payers for the insured. Third, the Act protects patients by ensuring that pre-treatment estimates are as transparent to the patient as possible. Finally, the Act seeks to make it easier for patients to compare provider prices as they are required to avail rough treatment estimates for all patients irrespective of their insurance status. The billing process, which includes patients, providers, and insurers, is largely confusing to say the least. A lot of patients are unable to separate their medical bills from an explanation of benefits statement. Couple the confusion of the billing process with the high likelihood of billing errors at 70 to 80% of medical bills and you have yourself some serious medical debt, especially when it gets to collections. The Centers for Medicare and Medicaid Services, CMS, found the billing error rate in Medicare fee-for-service claims was 8.5%. with the errors being attributed to simple coding complication, double billing, upcoding, and insufficient documentation. As a result, patients end up with bills that should have been covered by medical insurance due to errors such as incorrect codes or failing to attach appropriate authorization. Errors result in insurers delaying or denying payments to claims. Insurers also deny claims if the patient is deemed to have received unnecessary services, which then pushes the whole bill onto the patient with a whole lot of confusion attached to it, and the bill morphs into a debt and finally goes into collections.